Hi everyone, welcome to my channel. I'm Janae Cherie, and I'm here to talk to you about my decision-making process when it came to determining next steps and how to handle my breast cancer diagnosis. Please keep in mind that I am not a medical professional and nothing that I give here today is medical advice, but simply my own experiences and my own thought processes. Hopefully, what I share with you today will help someone else going through a similar conversation with their doctor. Always, of course, rely on your doctor for the best medical advice, but maybe this will help you understand how I navigated the terrain and made the decision for myself. And maybe that will help you. So I have breast cancer in my left breast, and there are three potential solutions for how to eradicate that cancer from that breast. And one of them is the lumpectomy, to go into the left breast, remove just the tissue that they believe is cancerous, remove it, and then utilize radiation and or chemo to ensure that it has not spread and it's eradicated from the rest of the tissue. And then there is a single mastectomy, which is removing all the breast tissue from the left breast. And with that, there would be a potential follow-up, a most likely follow-up of radiation and or chemo to ensure that it hasn't spread to the right side and that it's fully eradicated. And then there is the double mastectomy. And the benefit of the double mastectomy is that my doctor believes that we will likely not have to do radiation or chemo because we should be able to remove all of the breast tissue and all of the cancer cells and not have to do follow-up. So in terms of the initial pros and cons, right, there's the lumpectomy, which means that I get to keep most of my breast tissue. I don't need to do a full reconstruction. There would be some divots in the breast where there's probably less, because you're removing a big chunk of it, there's less tissue. But in terms of things like breastfeeding, I will likely be able to breastfeed in the future if I use that option. The single mastectomy, it would be removing all the tissue from the left side. Pros is that it's just focusing on the one side. The right side stays fully intact. The left side would either need reconstruction, or if we don't do reconstruction, it would end up being flat. It would be imbalanced, and we go from there. And then the double mastectomy is, of course, removing all of the tissue. And with removing all the tissue, the biggest positive thing from that is that it's extremely likely to remove all of the cancer. And according to my doctor, by doing a double mastectomy, it would reduce the likelihood of cancer recurrence to less than 5%, versus the lumpectomy and the single mastectomy. There's a much higher rate of recurrence in either the same breast or the right breast if we did the single mastectomy. And so I talked to my doctor about all these options when I went into the doctor's office right after getting the diagnosis, and I felt really conflicted for a couple of days. My partner and I have been planning to start a family next year, and so breastfeeding and nursing is something that really came to mind as something important to consider in terms of this solution. Society and medicine really encourages women to nurse, if we can, to provide the best outcomes for our babies. But if we don't have any breasts, how am I supposed to do that? How am I supposed to make the quote unquote best decision for my child if I physically don't have the ability to do so? And so with that in mind, I mean, while I was talking to the doctor about the three different options, I expressed my concern. I said, well, my partner and I really want to have children at some point, and I'd really like to be able to nurse my child. And my doctor was great. She says, I know that some women love nursing, but I just want you to know that I found it to be overrated. And then she goes on to share in length her personal struggles nursing and how difficult it was for her, how she wasn't even able to nurse one of her three children, and the other two didn't nurse for long because of difficulties. And it just really made me think about, what that benefits were. But let me tell you, I really struggled. I really struggled with this decision. I spent a couple weeks and my doctor had given me a week. She said, please decide in the next week. This is aggressive cancer. We want to get it out. We want to make sure that we're on the right path to, making you healthy again. So take a week, figure out what you want to do, and decide. And I admittedly took longer than a week. And there's quite a bit of tears. I didn't realize how much I had internalized society's view of breastfeeding and nursing as the only option for nutrition for your baby, which is silly because fed is best. If a baby's fed, the baby is getting what it needs. And yes, there's a lot of benefits shown by science and medical professionals that breastfeeding is the best thing for many infants. But if you can't do it, then obviously, giving the next best option, which is formula, or even purchasing breast milk from other sources, feeding your baby is best. And that's so silly. I'm envisioning hypotheticals with children I don't even have. I don't even know if I'll be able to bear children, frankly, because I've never tried. And yet I'm trying to make a cancer decision based on this emotion. And so at one point my partner asked me, goes, what are you thinking about this breast cancer diagnosis? So there's two sides of my brain. One side is the emotional side of my brain, which is saying we need to have the lumpectomy because then I'll be able to keep as much of my breast tissue as possible. I'll be able to nurse someday and be the best mom ever. And then there's the other side of my brain, which is like the very logical, this is the normally dominant side of my brain. FYI, it's normally not the emotional side of my brain. The logical side of my brain was going, Janae, the best likelihood of no cancer recurrence, the best outcomes, the best everything health-wise for you is to do the double mastectomy. We should not be considering future children in nursing in this decision because the best thing for your health is a double mastectomy. Well, those are two very different sides of my brain trying to fight for attention in this whole decision-making process. And I was having a hard time. I genuinely broke down in tears with my partner, Matt, about how I wanted to be able to nurse my children someday. And of course, he's so sweet. He was just like, Janae, you need to remember that your health is the most important. We need to make sure that you are alive. Our children are going to much rather have a mother versus having a nursing mother versus the alternative of not having a mother because she's died of cancer. It was just so surprising how intensely I felt this decision, and the root cause of this dilemma was in nursing a baby that doesn't exist. I was kind of flabbergasted, actually, about how intensely that made me feel. So I started doing a bunch of research, and I found a lot of different commentary online, but frankly, it's not the same as talking to somebody you know. So what did I do? I reached out to one of my dearest and best friends in the world. Her name is Jenny. And if you don't mind, I'm going to pull up the messages I shared with her and what she shared with me, because I think this was really helpful in processing. And so this is what I said to her. I said, hey, tell me what your experience was breastfeeding. The best answer medically to remove the cancer and remove as much of the risk of it coming back is to do the double mastectomy. But then I'll never be able to breastfeed my future children. I wish it didn't bother me so much, but I'd always assumed I'd be able to do that, and I wanted that to be part of the experience, which is true. I'd always just assumed I would be able to breastfeed my children if I ever had them, because that's what I would want to do. I did share with her, I said, my doctor and I talked about it. She's a mom of 3. She thinks breastfeeding is overrated. And I did say that Matt keeps reminding me that the most important thing is to get through this and live a long and happy life, cancer-free. And he's right. It feels silly to get hung up on not being able to nurse when this option gives me the best chance of surviving long term. What are your thoughts? And Jenny, the sweetest person ever, she said, With breastfeeding, I had the same experience as your doctor, actually. Baby number 1 couldn't latch and never successfully breastfeed. Honestly, she says it never affected our bond at all. I was really upset about it at first and tried pumping for all the health benefits to him, but honestly, that was also a nightmare. And when I gave up and relented to formula feed after 3 weeks, I was so much more rested and so much less stressed. It also makes them fuller too, so you don't have to do feedings quite as often, especially at night, and that's a lifesaver. Baby 2 and baby 3 breastfed. Well, I appreciated the bond at first. She says baby 2 latched literally right after being born while still covered in goo. It was special, but it didn't come also without challenges and tears as well. Frequent feedings and worrying about supply being enough and baby gaining enough weight. Can't measure when they feed directly, so there's no way to tell, but baby 2 was feeding every 30 minutes and had reflux and would throw the majority of it up afterwards. Also, there were food allergens from what I was eating, and I couldn't figure it out for the longest time what was making baby number 2 sick. It was so much more complicated than I ever thought it could be. My nipples were cracked and bleeding and painful the first month. Fortunately, we found out that he was tongue-tied, and they actually had to cut the little flap of skin under his tongue in order to help baby number 2 latch properly. Now baby number 3 was far easier, but still I had to wake up more frequently, and there's less freedom with your diet, and if you want to have a glass of wine, you have to pump and dump. All I can say is that I have to agree with your doctor. Kind of overrated as far as the experience of it. Not overrated as far as health benefits to the baby, but you can buy donated breast milk as well. She said bottle feeding and being able to look down onto your baby's eyes and love on them and their little hands reaches up to you still gives you that same experience of bonding with bottle feeding compared to breastfeeding. And I don't know what it is about reading something on the internet versus hearing it from your friend, but it was better hearing it from my friend. Many women can't do it, and the bonding situation is still there. The health benefits are still there. There are other health benefits. It didn't even occur to me that if I wanted to do breast milk, I can buy breast milk. And so if it's a nutrition issue that I'm worried about, there's options. If it's a bonding experience that I'm worried about, she says it wasn't affected. And many of the women I found online said it wasn't affected. And I realize I'm rambling, but this was a big deal. It felt like a big deal. And granted, having cancer in itself is a big deal. And having a major surgery is a big deal. So I'm not trying to minimize it. But there wasn't this whole breastfeeding element is what was really causing me to hang up on what to do. The medical decision for me was, frankly, a no-brainer. I needed to do a double mastectomy. My BRCA1 cancer gene history with 80% chance of breast cancer and 60% chance of ovarian in my lifetime, which of course now it's 100% because I have breast cancer. And the likelihood of it coming back, the decision should have been a no-brainer. Do the double mastectomy, make it go away, dramatically reduce the risk of breast cancer ever coming back, and be healthy and happy and safe and move forward. But this nursing thing was causing me a hang up. And after hearing from her and taking a couple days to process, I was doing pretty good. I started really being able to take that step back and go, you know what? If I'm not nursing, I don't have to do all the feedings by myself. My partner can split them with me, and maybe we can do the midnight feedings together. We can rotate, and it's easier to pack, for a babysitter. I don't have to pump every 2 or 3 or 4 hours. There's a whole lot of benefits to not breastfeeding that we don't really talk about in terms of convenience for the mother, but it is much more convenient. And there are ways to get that same health and nutrition by purchasing breast milk from other women so that I don't feel like, if it's that important, that I don't feel like I'm minimizing those or lacking those health benefits. And it's just going to be so much easier in the future. And once I had come to terms with that, that there were options for me, and it wasn't just you only have to do this or you only have to do that. It became an easy decision, and it became an easy decision to do the double mastectomy. I need to do the best thing for myself and for my body, and that is to do the full double mastectomy, to eradicate the cancer that's currently here, to hopefully be able to avoid chemo and radiation entirely. According to my doctor, we shouldn't have to do it. If all goes well, we shouldn't have to do chemo and radiation with the double mastectomy. And it gives the least likely possibility of recurrence in the future. So that's the decision. That's how we're moving forward. And I just wanted to share that with you. I'm sure that I am not the only woman who's had quite the dilemma moving forward. A friend of mine who was diagnosed with breast cancer last year, she and I had talked very briefly about, was she willing to do the full mastectomy or not? And I know she was on the fence at the time as well. And it is tough. And I hope that if you're in that place in your life and you have to make that decision, that it's not a complicated decision for you, and that you're able to make the best decision for yourself health-wise without being too much of a struggle. But if it is a struggle, I just want you to know that I completely understand, and I feel your pain. So as we wrap this up, I would encourage you to share your story. What was the decision-making factors for you? Did you do a lumpectomy or a single mastectomy, or did you do the double mastectomy? And what was it that made you change your mind one way or the other? And if you've already done it, how did that work out? Do you regret your decision, or do you feel like you made the right decision in the long run for yourself? And anyway, thank you all for joining. This is Janae Cherie. I'm here to tell my stories, and I'm really here to hear yours as well. So thank you so much. Have a wonderful day.